okay, which has to be understood, and you are going to write about that particular problem. Okay, now once you have mentioned about the epidemiological features of this particular problem, okay, including the risk factors. Now, whenever you are trying to, for example, if you want to write a risk factor or any tests which are already done, so you have to mention the existing option available. It may be treatment. What are the existing treatments available? What are the existing diagnostic methods available? So everything you have to mention. Okay, so you have to explain them. Okay, based on the articles what you have searched, because they would have mentioned all the risk factors, what are the tests which are done. So you are going to mention what are the existing options available for that particular condition. Now, among them, now you have identified something which you want to do, and you have identified those gaps in those particular literature which is already available. So you have identified the gaps now. Now you are trying to fill that gap. That is what is your research question. Okay, so the necessity to take up this study, you identified with that. There is one method which is available, which has got a disadvantage. Now you want to test some new method which is not having that disadvantage. So you are going to raise a research question. So you identified the gap. That is a necessity to take up this study. So once you identify, these are the things which are, this is the limited amount you are supposed to write. Okay, blood HbA1c more than this is pre-diabetic, HbA1c less than this. All those operational definitions, it has to come in the different area. Here only about the problem exists, what are the risk factors, and say for example, if it is not treated, for example, if the diabetic foot is not treated, what is the outcome of that and why you are going to select that. Okay, so there may be morbidity may be increased or mortality may be increased. So once you start mentioning all this, then somebody who is reading your topic, okay, so he has selected a topic which is having a much relevance and it is to be utilized for the treatment purpose or diagnostic purpose. At the end of this, once you identify the gap, now you are going to conclude by writing a paragraph stating that, okay, so I am going to do this, hence I am going to do this study, which is going to benefit the community. And at the end, you should also make a hypothesis, which is a tentative prediction. Do not directly, do not tell that this is better or that. Okay, so always make a tentative prediction. Make a tentative prediction, that is called as hypothetical statement, what you are going to do. So once you have written about the introduction, now is how are you going to do the research? So this, how to structure the research for this, who has done this research, where they are done, how they are done, when they are done, all this has to be written in your own words. That is called as review of literature. If somebody wants to test any postgraduate, how effectively has read the literature, this is the strength, review of literature is the strength of assessing any postgraduate. Okay, how effectively he has understood the previous researcher, what they have done. Now, why this review of literature? This review of literature is required because it is going to familiarize the reader. Okay, what all the previous researchers have done, what work they have done, they are going to describe the work done, what are the difficulties they have faced when they have done the research, and what are the corrective steps. All these things they would have mentioned in the articles which you are supposed to understand. Next, in the end, they would have also explained about the gaps. So you have to identify those gaps. And of course, they also would have identified some variables. So you have to identify those variables along with that variables only you are going to frame the objectives. And whenever you are selecting the articles, see that you are going to take less than 5 years, as already told. Ideally, 8 to 10 articles is sufficient. Okay, there is no need to have 20-30 articles for your synopsis. If it is available, reserve it for your final dissertation. But as of now, for synopsis, reserve only 8 to 10 articles is the idea. If it is very rare, okay, you don't have any articles, even 5 years also sufficient, but you should show that sufficient search has been done. Not many studies have been conducted. And whenever you are writing the review of literature, you see that your words are restricted to 300 word count only. Now, how to write this review of literature? Because this is the area which we find many times, okay, whatever is there in the article, they directly copy and paste it. Okay, so review of literature, it should be always written in your own words and it has to be written in past tense only. Okay, see that you are going to write it in past tense only because somebody has done before, so it has to be written in past tense only. So how are you going to write this? Now, once you have collected all the articles, you have analyzed, now you have to arrange it according to the order. I'll tell what are the different methods of arranging it, and then you are going to summarize it. Okay, and whenever you are selecting any article, the article should be related to your study only. Okay, it should have whatever the variables what you are going to measure, that has to be measured by even your previous researcher. Then only you can have a good discussion. Okay, so what are the articles what you have selected now? You have to see that what are the positives, that is comparing, what are the negatives, contrasting, what are the limitations or gaps of the previous studies, which has to be clearly documented. You have to give all the results. You can't just put in one sentence, a study conducted there, they showed highly significant over this. That is not completion of your review of literature. Review of literature means so-and-so has conducted a study in that particular institution involving so many participants, what type of study it was done, and what were the results they observed, and what was the discussion they made, and what was the conclusion they made. You have to put all the facts and figures in the review of literature. Only if you put facts and figures in the literature, review of literature, that will be utilized in your study, because in the discussion, you are going to use these review of literature values for your discussion, whether you are accepting their results or you are contradicting the results. Okay, to write an effective discussion, you have to have a review of literature which contains all these things. Now, how to write this? There are 4 different methods. Okay, number 1, you can go with the chronological. Chronological means you can start with the oldest. Now, for example, you have, say, for example, you selected from 2000 onwards. So, what are the studies which are done in 2017 related to your study? So, take that. Okay, so first is 2000, next 2018, 19, 20. So, maintain this chronology, because the purpose of having this chronology is how it has progressed over a period of years, and how what is that the end you are going to try to find out. That becomes your aim. So if you write it haphazardly because you want to show that 2021 is the latest one as a first review of literature, that is not correct. So you should always try to put it as a chronological, that is oldest to the latest. The other method which can be followed is geographical method. So you can start the international literature, whatever they have found. Next, we can have the national, then the local. So that is also chronology. So you can't put the local literature first, then the national one. So again, there you have to follow that. Third one is advancement. For example, any instrument, just like the mobiles, how it advances over 1, 2, 3 versions. So there is an advancement. There is something called some scoring which is used. Next, they would have used a modified score, then further modified. Okay, so there is an advancement. How, whatever the investigations or whatever treatment, how it has advanced over a period of year, that is called as advancement. Okay, that is the third method. Fourth method is questions. Now you are ready with some questions which you want to study in that particular research. So based on that, you can create certain questions. Now, for example, I want to study prevalence. So what you are going to do? Okay, this is supposed to be the better method compared to all, because you are going to summarize all the articles in one paragraph. Okay, now for example, I want to study prevalence. Okay, so you are going to check all the articles and you are going to find out what was the prevalence in all the articles, and you are going to write that paragraph fully about prevalence. And whenever you are writing fully about all the articles, using all the articles, whatever the figures, okay, you have to put all the 5 articles or 6 articles, whatever number of articles, references has to be put there. Okay, so that is number 1. Next, for example, if you want to assess the risk factors. So what are risk factors in article number 1? What are risk factors in article 2? Okay, so you can create certain questions. What exactly you want to test or assess in your particular study, you can create that questions, and accordingly you can make it. And what are the values you are going to mention? See that this is from this particular article. It has to be cited properly. So these are the 4 different methods. Number 1 is chronological. Number 2 is geographical. Number 3, the advancement. Number 4 is questions method. So at the end of writing a review of literature, now you are ready with what you are supposed to do. So what is the next step you are going to do at the end of your literature? Now you are ready with your what I am supposed to do. That is called as aim. Okay, so the next step is you are going to write the aim and objective. So aim is the ultimate thing, what you want to achieve. And how you are going to achieve is the objectives. Okay, so remember, aim always it is 1, and objectives can be multiple. Okay, so aim, when it is almost most of the time, the title and aim will be almost similar. So you can have only one aim and you can have multiple objectives. Okay, even the objectives can be restricted to 2 to 3 or maximum 4 objectives. Do not try to have too many objectives. When you have too many objectives, your results and your discussion becomes much difficult while writing your dissertation. Now, if you look at this, okay, there is an aim, you got a primary objective and you got a secondary objective. So primary objective, exactly what you want to assess here. And secondary objective, additional things what you are going to find, but all should be related. Aim, objectives, everything should be interrelated. Only if they're interrelated, then only your aim and objectives are matched. If the objectives do not match with the aim, then the whole process, whatever the time you have invested, is going to be wasted. Okay, as I already told, see that you are going to restrict to 2 to 3 objectives. That is more than sufficient to write a dissertation. Whenever you are writing the objectives, always keep in mind about this SMART, being smart. What is this SMART? SMART here indicates S is specific. It should be very specific. What you are going to assess, it should be specific. It should not be a vague term. Okay, always it should be specific. And whether you are able to measure whatever the studies you do, if you are not able to measure, your objectives will go for failure. Next is whether the objective, what you mentioned, is it attainable? Can you attain whatever you mentioned? Is it attainable? And is it relevant? Is it relevant? Because whenever you write an object, whatever, there should be some relevance. If it is not relevant, do not write the objective. Okay, so whatever the objective, if it is not relevant to pertinent to your aim, you can use those data in your discussion results. You can add it as an add-on. But the moment you write it as an objective, it should be reflecting in your result. If you mention it as objective, it should be reflecting in the result. If you are getting some result, some information, but still you can add in your result, but not in the objective. But remember, objective and result should match. Okay, anything extra in result is always accepted. Okay, next is it should be all whether it is or whether you are able to finish these objectives in a specified time. Okay, now you have been given a specified time of finishing this. So are you able to finish this in that particular time? So why this objective? It always gives the direction. Okay, how you are supposed to do the research. Okay, direction for your study. And it also mainly focuses on the way how to measure the variables. Okay, so you have identified some variables which you are supposed to assess. Okay, it gives an idea. Next is it also gives the method of identifying the relationship or the difference between the variables. So for this purpose, you should have a good objective and try to restrict the number of objectives. Unnecessary collection of any data is waste of time. Okay, so if somebody wants to do an extra paper, if you want to publish something, you can take unnecessary data, additional data, but otherwise for a dissertation purpose, restrict to it. However, because you are wasting your resources. So if you look at this, this is one simple example. Okay, so what is this? To assess the knowledge of staff nurse working in psychiatric unit regarding physical restraint. This is what I want to do. That is what I want to achieve. That is my aim. Objective for this is to assess the knowledge regarding, first you are going to assess the knowledge. Okay, then you are going to give the training for the nurses regarding the physical restraint. So for that, you can use to analyze, to assess, to analyze, to find. Okay, so these are called as action verbs. You can't write effect of plan teaching on physical restraint. Without action verb, your objective is incomplete. So how are you going to do? There should be always an action verb. And what action verb you are supposed to use for your study, it all depends on what you are trying to study here. Okay, so see, these are some of the examples which are available on the net. Okay, you can see, so for example, if you want to analyze something, so you can use action verb to analyze, to appraise, to define, to explore, to identify. So there are for different purpose, what you are trying to identify, there are certain action verbs. These action verbs can be utilized here. So if you are writing the correct one, okay, it is going to give the correct result, and the chances of rejecting your synopsis also will be reduced. Okay, so plenty of things are available. Okay, so you can go through it and see that you are going to use the proper action verb for writing the objective. Especially when you are writing any objective, you see that you are not going to use these vague terms to appreciate, to understand, to study. Okay, even sometimes to evaluate. Some people they use it, some they accept it. Okay, so whatever the standard articles, whatever the articles, what as such, most of the places they are told not to use this. The moment they see that to appreciate, to understand, to study, to evaluate, that means your objective is not specific. You can't measure them. Appreciate means how are you going to measure it? Understand means how are you going to measure it? So it is not possible. So always try to avoid this action verbs. Okay, so it gives a wrong information. So once your aim and objectives are ready, now you are going to the next stage, that is writing the methodology. So writing the methodology, there are certain components which should be always present in your synopsis. Okay, so whichever the articles which are selected, somebody has already done a suitable method. Based on that method, you can follow the same method. But when whatever the methodology if you are trying to follow, see that you are going to quote that methodology, cite that in your references. Okay, so these are some of the things which are there. I'll just go one by one. What are things which should be there in the methodology? Your ethical clearance, how you are going to get the ethical clearance, your informed consent, how are you going to take it, study settings, study design, sample size, sampling method, what you're going to use, operational definitions, randomization, inclusion, exclusion criteria, study method, whether if you are using any group, if there is a control, next is data collection, how you are going to collect statistical. All these should be there in the methodology. Okay, and when you write all these things, you can see that the amount of word count which is given is 150 to 200 words. So many times what happens is there is repetition of words. The words are repeated, conducted at a particular hospital involving this, having the fulfilling inclusion criteria. So you have to see that as specific as possible so that your word count, including all the components, are there in the methodology. And whenever you are writing methodology, again, because many times the PE students they copy from the other this thing and they try to write in the same this thing. So it should be always in the future tense. I will be doing like this. I will be randomizing. So it should be always in the future tense. Do not write in the past tense. Were done, were allotted. That indicates that immediately that it is already done and you are copied from somebody else. Okay, so you have to be very careful about that. So one by one, just in brief about that. Number one, any studies involving human beings always should have ethical clearance. Even the animal experiment, if you want to do, there should be a approval letter. So only if you have got approval letter, then only you can do a study. So in your synopsis, you can just write, okay, applied for ethical clearance, okay, awaited. Okay, so once you submit, while submitting, you have to submit the ethical clearance. Okay, when you are submitting for your scientific review or ethical clearance, it is awaited. Okay, but once for the final submission, you should always mention it is clear and you have to attach the ethical clearance. And always see that you are going to attach the ethical clearance certificate, a copy of it. Do not lose the original, because this original ethical clearance certificate should be retained, because the moment you complete this study, when you go for publication, now almost all the journal authors, they ask for ethical clearance certificate. Okay, so many times what happens is you do a study, then come for ethical clearance. That is not ethical. So ideally, you see that you take the ethical clearance, retain that ethical clearance certificate with you only. Next is the informed consent document. So you have to prepare a valid informed consent document, which is as simple as possible, and it should be in a local language, which contains certain essential elements which has to be there. Okay, so initially we used to use only that signature page as a consent. Okay, I have read all this, I have know all this thing, accepting. That is not the informed consent document. So it has to be containing even the patient information sheet. If you want to have this informed consent document, okay, you can visit the WHO website where they have got a standard template, what all has to be filled at what level. Okay, right from your introduction, purpose, recent benefit, how it has to fill, everything is there in the WHO website. You can download it and you can start filling it. And this document also should be attached when you apply for ethical clearance and even for your final submission. Okay, so you should see that your informed consent document, and how are you going to take this informed consent, that process, that is called as process, that should also be mentioned in your methodology. whether you are going to take it personally, whether you are taking it as an interview or implied consent. So what method you are going to take. And in this, there are some terms which you have to understand here. Number one is implied consent. So what is this implied consent? Now, many times nowadays we see most of the people, they share this Google Forms, okay, as a survey method. So in the beginning only, they'll put on statement, if you are interested, okay, you can start filling this form. Okay, the moment they enter there, start filling the form, that means they are implied, it is implied. They are accepted to be a part of that particular study. Okay, or you want to do, for example, a survey. You call some several number of people into one auditorium and to one hall. And the moment you give the invitation, if whoever comes there, that indicates if they are interested to be a part of study. That is the meaning of implied consent. And there is something called as waiver of consent. Okay, so wherever there is no involvement of humans, you are involving only the specimen. Okay, in such cases, you can request, you cannot decide on this, you have to apply for the ethics committee for waiver of consent. So ethics committee will decide whether there can be a waiver for this particular study. Then in such cases, if you are doing, for example, a specimen, urine specimen or pathological specimen, in such cases, if you want to do any study, in such this thing, you have to ask for the specimen release form. There is something called a specimen release form, which has to be addressed to the head of the department who is holding that specimen. Okay, you ask for that. Suppose if you want to get the data from the MRD, medical record department. Okay, in such cases, you have to take a permission letter from the authorities. Who is authority for MRD? Usually it will be the medical superintendent. So from the medical superintendent or from the principal, you are going to take the permission to retrieve the data. So these are some of the documents which the ethics committee asks for without their permission, because you are accessing the medical record of somebody else who just contain all the details. So their access is restricted. So in such cases, you have to take the permission from the concerned authorities, and you have to attach when you take when you apply for the ethics committee. Next, you are going to write about the study design. Study design, again, it is a vast subject. I will not go in detail about what are the study design. There are two types, basically two types of study design. Okay, so one is the observation, other one is the experimental. So based on what type of study you are planning to do, according to that, okay, you can give the title. Okay, I'll give the example here. Say, for example, purpose to determine the frequency and burden of the disease. So in such cases, you can do what is called as a cross-section study or cohort study for the incidence, prevalence for the cross-section study. And whenever you are using this, there is always a controversy with the use of this prevalence and incidence whenever you are doing at the institution level. Okay, although it can be used, but as far as possible, try to avoid this prevalence and incidence unless you have a proper denominator. Okay, otherwise it is better to avoid. Okay, so frequency will be better, number of fresh cases detected. So try to use some common words instead of using prevalence, incidence, unless you are going into a community where the population is defined. Next is, if you want to identify risk factors, you have got a cohort study. Okay, then if you want to determine progress of a disease, again, cohort study. Determine efficacy, effectiveness. So depending on what type of study you want to do, study design you have selected, what you want to identify, you can select the study design. And most of the time for this purpose, you have to meet a suitable person who can guide you what is the best method for this particular study. So ideally, we suggest is before meeting, before starting all these things, ideally you have to meet a statistician, because he is a better person who can guide you what study design and for the other things. Next thing, what you are going to write here is study setting, where you are going to do, just where is the place. Okay, so Siddhartha Medical College and Hospital, Tumkur, that's all. So again, what happens many times, again, full completely you are going to read. Next is period of study, just 24 months. Who are the target population? It's, sorry, exam type error, it is participants. Initially, they used to call us, if they are patient, they used to call us patient, and if it is healthy volunteers, we used to call them as subjects. Now, any person who is involving in any particular research, they are all called as participants. Even when you are writing a discussion, see that how many participants were involved. So, target population, who are the participants? Whether they are students, whether they are patients, okay, who volunteers, who are they? So, you have to use the term participants. Okay, so be specific, do not try to elaborate too much. Next is, you have to mention about the sample size and the sampling method. So both has to mention. Now, if you look at this, the population, which is commonly denoted as capital N, and the sample is the small n. Okay, so you are going to take a small sample from the population, that is the target population. Okay, from this target population, you are going to do a sampling method, what type of sampling method you want to do. And then you are going to calculate the sample size. Once you calculate the sample size, then you are going to collect the information, that is data collection. Okay, you see that you are going to mention what is sampling method and how you are going to calculate the sample size. Again, to calculate the sample size, if your institution has already conducted research methodology workshop, they would have already taught you what is sample size, what are the sampling methods available. Based on that, you can start entry. What is sampling method? What is sample size? In the sample size, again, you have to mention, okay, how you have calculated the sample size. So the formula and the substitution for all the formulas you have to mention there, whatever is there, and including whatever the power, what you are going to use, you have to mention the statistical power. And even when you are mentioning about the sample size, see that you are also considering the non-responders also, because sometimes there may be dropout, they may not come up. So even the non-responders also you have to consider. And whenever the sample size is calculated, it is for one group only. Remember, okay, they calculate, for example, cases are there. There are two groups or sometimes three groups. And when they calculate the sample size, it is for the one group. Okay, many times what happens is they get confused. So sample size means all three groups put together 90. So they divide 30, 30, 30. That is not correct. Okay, if they give sample size for one group 90, then you have to allot 90 for each group. Okay, remember this. Okay, it is, you are not going to divide it. It has to be multiplied for any number of groups what you are going to use it. Then there are different methods, probability sampling and non-probability sampling. Probability sampling usually done for the quantitative analysis, where you are going to get a very valid data, and non-probability sampling, which is usually done for qualitative studies. Okay, all this I think you can, they would have taught already in this. Okay, I will not go in detail because it will take a longer time. Then you are going to mention about the inclusion and exclusion criteria. Okay, again, what is the mistake here? Inclusion, exclusion criteria. Inclusion means who are the subjects, participants who will be included in the study. And whoever has been included, for example, diabetic patients means only diabetic patient. Okay, in the exclusion, do not mention non-diabetic patient. That is not correct. Among the diabetic patient, whom you want to include there, you have to specify whom you want to exclude among the diabetic patients. So exclusion is part of the inclusion. That sample only you have to exclude. It is not the separate one. And you have to mention about the age group, age category, and even the sex who are involved. And next is you have those who are willing, not willing. Okay, if you have mentioned in inclusion those who are willing to participate in study, okay, there is no need to mention in exclusion those who are not willing. Okay, so there is no need to repeat. And whenever in the inclusion, as far as the age is concerned, okay, so if you are using any patients 18 and above, there is not much problem. But if you are using patients inclusion criteria less than 18 years, okay, then you have to look into the consent form, which is different. For example, if the participants are from the age of 0 to 7 years, then you have to use a parental consent. From 7 to 14 years, you have to use assent to consent with parental consent. And if it is more than 14, you have to use a pediatric consent form. Only for that reason, you have to be very careful when you are trying to include the patient. If it is pediatric, there is no alternative. You have to involve the pediatric, and you should know how to prepare the consent form for them. What are the methods you are going to use for collecting the data? Okay, it may be a questionnaire, it may be a survey, it may be interview, or it may be any diagnostic procedure, laboratory investigation, any screening procedure. Whatever the method you are going to use, you specify that method, and whatever the questionnaire if you want to use, for example, psychiatry or some assessment, some scoring systems, if you are trying to use it, you have to cite the reference. What is the method? Okay, and if you have cited, and sometimes even they ask for the permission. Okay, whoever has done that particular instrument for measuring, okay, you have to take permission from them. Okay, so if it's available online, okay, it is almost good as you can use it. But still, if you want to have more protection, okay, you can ask for the accept the permission, and then you can start using that questionnaire. Suppose if you are planning to have your own questionnaire, semi-structured questionnaire or questionnaire you want to do it, okay, preferably get it validated. If you get it validated, it is definitely an added advantage, okay, because other person can start using your questionnaire and your citation will be increased. What are the data what you have collected? Now you have to, how you are going to collect and how you are going to collect. So you are going to collect all the data into what instrument? Most of the time you are going to collect all the data into the Excel sheet, and how you are going to enter, you have to mention. And next is, what are the statistical tests which you are going to administer? Okay, so what are the statistical tests? Do not write appropriate statistical methods will be used. You have to mention what statistical test. If it is a categorical variable, non-categorical variable, if you want to compare to, okay, what test you are going to administer, including sensitivity, specificity, ROC, what you are going to measure, analyze, all those things has to be mentioned in how you are going to collect data and how you are going to analyze. Avoid using appropriate statistical methods will be used. Okay, once you are ready with this, now you are ready to give the title. Now you have to plan the title exactly. Okay, and what are the title what you are supposed to give? It should be catchy, neither too small or not too long. Okay, there are some specifications which they are given. Okay, as far as possible, 850 to 100 characters, that is the ideal one, which is around 12 to 15 words. Okay, see that you are limiting into this only, so that acceptance will be better. So in the title, what is the topic you are going to do? What is the method? Who are the sample? And what is that you are going to expect results? Okay, a simple example what I have taken is meditation makes students perform better. That is a result what you are expecting. And you can see here it is a colon, it is not semicolon. A qualitative method. What method you are going to study of mindfulness meditation? Okay, mindfulness meditation is the topic. Among whom? It is among the first MBBS student. That is the sample. So when you are writing the title, you see that at least these characters are there, and there are certain things which you are supposed to avoid in title. What are those to be avoided in title? Avoid medical jargons, unnecessary too much, because we try to project the title in such a way that it is very catchy, too much catchy. That too much catchy should not be there. It should be catchy, that's all. Avoid jargons. Name of the institution should be avoided. Okay, conducted at Siddhartha Medical College should be avoided. Name of the institution. Conducted during the period, which period, involving so many numbers, all this should be avoided. And any type of hyphens or dashes in between the words to be avoided. Do not use any such type of hyphens or dashes. Next, when you are writing a title, do not use chemical formula in the title. Okay, even though they are standard chemical formula, better to avoid. Next is avoid using Roman numerals. Next is semicolons only. Okay, do not avoid using semicolons, use only colon. Next is do not use abbreviations in the title. Even if you are using abbreviation, expand the full one, and in the bracket you put the abbreviation. And do not put a question mark in the title itself. Okay, to question what you are planning to do. And there are some things which, some of the articles which they should report on a study of results of first of its kind in our institution. All those exaggerated statement has to be avoided. And whenever you are using any title, okay, italics should be avoided unless you are writing it for any specific organism. Okay, italics should not be used. Then shorten these scientific names. Okay, do not shorten the scientific name. Okay, don't just put coli. You have to write Escherichia coli. Do not shorten all these scientific names. So these are the things which you have to avoid when you are writing the title. Last one is references. Okay, most of the universities, they ask for the rank hostel. So rank hostel always tells it should be number one should be mentioned as a superscript. So it should be always written in order. So whatever it has been cited in the literature article, which is cited 1, 2, 3, 4, 5. Citation should be always 1, 2, 3, 4. Okay, the moment you get some new information, do not add there. If you add there, change the citation. 1, 2, 3, 4, it should be continuous. And it should be always in the rank over step. So always remember, citation, starting from introduction, it should be continuous. Suppose if from the first article, you are trying to repeat the same, some information from the first article only, again, you have to write the same one. Do not try to add a U number for that particular. What are the annexes you are going to give here? Whenever you are submitting to any of the authorities, number one, you are going to prepare the case report form. Case report or case record forms should not be a replica of your case sheets. Case sheet is different, case report form is different. What is this case report form? case report form, you are going to prepare in such a way that you are going to have the demographic characters in the initial part 1. Next is whatever the data, what you want to capture for your objectives, try to highlight that and put those things on. If there is a follow, put a follow. Okay. Next is informed consent form. So you have to see that informed consent form is prepared, and better to give it in the local language form. If it is Karnataka, Kannada, if it is in Tamil Nadu, you should also give it in the local language form. Both has to be there. Okay, so both has to be translated properly by a translator. Next is if you are using any instrument, study questionnaires. Okay, so copy of that questionnaire or instrument which you are going to use has to be attached. Next is when you submit finally for the university, approval letters from the ethics committee should be there. So these are the annexes which should be kept ready. Do not lose anything. Always keep a copy with you. And nowadays, even the government of India is insisting on whatever the project research, what you are going to do on humans has to be registered. So you all can go through this, how to register. That is clinical trial registry in India. For clinical trials, it is mandatory, but for other studies also, because it gives indication that I am doing it. Okay, nobody else has to do it. That means you are authenticating that I have already registered. You cannot do it. Okay, and if somebody is already doing, there is no point in you doing and again repeating the same thing. So that is the one of the reasons why registration mandatory. Most important thing I already told you. Do not go to the statistician in the end for statistically significant results. Okay, so always go to the statistician or community medicine at the earlier phase only and see that what is the study design, what you want to use for this, what is the statistical sample size, what you want to use, what is the sampling method. So all this has to be decided before only, then only you can get a better results out of it. So always see that you are going to meet the statistician prior to your study. These are some of the references which I used to prepare this. Along with this, even the Google search made plenty of information collected, especially the images I have used. And any questions I'm ready to take, or you can type it there so that I can answer.
Thanks a lot, Dr. Manjunath, for an excellent, you spoke in bits about everything. So almost like you briefed about the whole aspect as far as the dissertation is concerned. So I think Dr. Manjunath is ready for take the questions from the participants. We also shared the form in the chat box, feedback form. You can fill the form meanwhile. And I will also share the contact numbers in case you want to contact anybody as far as the certificates is concerned. Any questions you can ask now.
Okay. Good afternoon, sir. This is Dr. Shashiraj. Okay. First, let me thank Dr. Manjunath for a detailed presentation. I have a question regarding the choosing a topic. We know how it happens. Usually, postgraduate goes and the guide says do something in diabetes. He comes out with 3 or 4 papers. He chooses one. That is what routinely happens. Suppose if a student is also interested, if he really wants to find out something new or investigate something new, then the question of feasibility comes. So I just want to find out, how do you balance between both things?
I think I want to tell this issue. Most of the time, it is the guide decides what topic has to be done. Ideally, if the student is interested, the guide should see that whatever the student is interested, he has to accept it. Student has to go ahead. Okay, only thing is feasibility, definitely understood. Feasibility, depending on the local availability, maybe guide would have told. But still, ideally, what the student is interested, I think the guide has to approve it. Instead of what the guide decides, the student has to do, because always we can't force any student to do the research. It is always better the student comes with the topic and the guide helps him.
Thank you.
Any other questions?
Anyone else?
Hello,
Yes, sir.
sir. Purushottam from SIMS.
Any question?
Sir, in our synopsis where the PG submit, in the review of literature, most of them they have quoted different studies, and they explain the result also. They in the review of literature they've only done that, mentioning different studies. Is that enough, or something more to be done at the end?
No, it is not that just only results as you mentioned. Actually, they have to, what was the discussion in that? What is that they have accepted? Comparing, what was the contrasting? Because there is always a discussion there. So you have to mention those lines, because that's what we see only. Sometimes they won't even put the results also. Results along with that, what are the comparing positives, negatives, and what are the critics in that? So that you can, if you mention that, that can be addressed. Because that is one of the lead, so for example, they have found some problem, you are going to avoid that negatives in your study. So that has to be mentioned. If you don't mention and if you don't read that, you are going to end up with doing unnecessary research.
Okay, sir. Thank you, sir.
Any other questions?
Hello, sir. Good morning.
Good morning, sir.
Yeah, I'm Dr. Shivamurthy.
Yes, sir. Please, sir.
Actually, I'm sorry I could not join early. Somehow, I was busy with something. Good number of students are, participating in this. I just thought, I'll put forward my thoughts on this selection of topic. Basically, what I would say that, like most importantly, they should see the feasibility. That is very important. What are the resources available in the department? Second is that, and also whether it is publishable. Most important is whether it is relevant to the current status and whether it will be accepted in a good journal. Because now anyway, regulators and NMC, they have put forward that this research need to be published, and also they need to have some presentations in the journals, journal clubs, or in the conferences and all. So that is also very important. And also from the student point of view, they should put their efforts. It's not that, it's not an easy way. Like if we take some project which are not of any value and just for the documentation purpose, if we do, it is of no value. And it should be useful for the scientific community and how it is, seen by how it is used by the society, and also applicable to the patients and the treatment methodology and application of the research.
What I want to.
Yes, sir.
I think I told about this final formula in the beginning only. Maybe you are joined later.
Okay, sir.
Okay. Now, one thing is for publication, whatever you are telling, it is agreed. But nowadays, what is happening? The number of postgraduates are so much increased in each institution. I think even the guides are finding difficulty in conducting the study, approving, because now one department says some 10 pages. They are finding definitely based on the feasibility. 10 pages giving a topic itself now become a big issue now.
Okay.
I think now the guides have to start making list of topics which has to be made, so that at least give some idea for the postgraduates.
Yeah, so that I agree with you. I think when so many people are every year, 5-6 people are coming into the department, and everyone has to take the subject. That will be a challenge, and also it should be a new one. And best idea is that they should keep on looking at the table of contents in various journals that are published. So if they keep on looking into it, most probably they will find some suitable one by international journal list of a table of contents of various journals that are published every day in, day out, they publish. And also some burning issue, like we got COVID recently, then due to that, so many research projects were done. Similarly, monkeypox and other things they can work on. And similarly, like what are the other challenges that are propping up in the recent futures, like new drugs are introduced, and new formulations are introduced. So there can be comparison of existing old formulation and new formulation also they can include. So like that, I believe that, and also like change in the trend of disease, change in the trend of therapies also. And recently we saw that hydrocortisone should be used, and there were controversies also related to it, whether we should use steroids or not, and if we, what is the outcome of it, like that. And HCQ was a controversy. So there can be research on these things, like what are the perceptions or what are the outcomes, what are the, these will be complicated designs actually.
Yeah,
so
that is it. Now, only thing is, as a faculty members, I think you can take up these projects. Or
Yes,
as
sir.
postgraduate, definitely these things are quite difficult to manage. Okay, unless they have got a good facility and patient load, I think they can take. Otherwise, again, it will be waste of study, waste of resources, time, everything. Okay.
And also a little bit of understanding about the statics will also help, sir, actually. So because like what I was talking is that, like auditing the files, most of the people think that auditing files means is just, like cooking, what I'm saying is just listing out all the therapeutics, what are the diseases, and just making them tables, and then, say that this was frequent, that was frequent, like that. But that is, very superficial. I believe that these studies can be a little bit more detailed also. So they can get into the disease process, how it is influencing on the laboratory analysis, how these are influencing on the other outcome measures, and they can understand the correlation coefficients, and also progression of the disease based on the age group, sex, yes, sir.
Actually, I think these things can be taught in research. That's what I told beginning only.
Yes, sir.
Okay,
Yes,
it is
sir,
only how to write a synopsis. Definitely, what you are telling is applicable for research methodology. Definitely, we'll take up
Yes, sir.
that topic
Yes,
some other time. We
Yes,
can have
thank you, sir.
exclusive only. That
Yeah, I
series,
understand. Actually, since I just joined very late, I'm sorry for that.
Because now the postgraduates are submitting for the university. I don't want anybody's synopsis to be rejected. So what best can be done? Whatever you are telling, definitely is accepted, but we'll take it in the research methodology rather than here.
Yes, sir. Thank you, sir. Very nice.
Thank you. Thank you.
Thanks a lot, Shivamurthy, Dr. Shivamurthy, for enlightening us. Also, maybe as Manjunath is telling, we will also take your inputs, and also we can be able to conduct some session over a period of time as far as those things are concerned. Thanks a lot.
Yes. Thank you.
Manju?
There is one question from Dr. Sangeeta. A few words about validation of questionnaire. Okay, definitely you can prepare a questionnaire. Initially, you can try and can have a peer review. Okay, then you can do a pilot study. Once a pilot study is there, then using appropriate statistical test, I think you can validate your questionnaire. So first thing is you have to prepare, give it for a few participants, what are the difficulties they have found, then give it to some peers across your subject. Afterwards, you apply this this thing for a few regular participants, do a pilot study. Once you can, then they are able to fill all your questionnaires without any difficulty. That means you can validate that questionnaire. So for that, I think some statistical tests are applied, which can be adopted, and you can validate your question. Once your question is validated and published, I think even others can use it. Many times what happens is wastage of time. Even validation of questionnaire itself is one paper which can be published. What is the method adopted? Any more questions I can take up?
Anybody else?
Okay.
Shall we close the session, Dr. Manju? No other questions are.
Thank all the participants who are involved and listening to this talk. Okay, and thank Dr. Narayan for hosting from the Siddharth Institute of Medical Science. Okay, thank you all. Have a good day.
Thanks a lot. Thanks a lot. Kindly fill the form. You can download the form and you can fill the form. So, and all the participants will get, whoever sent the feedback form will be, they will be getting the certificates. Thank you.